It's official, at least for now. The Israeli government has just approved a 2-week full lockdown starting on Thursday at midnight. That means Thursday at 11:59 p.m., not Friday. Now, this means that all schools and businesses are closing except for essential shops like grocery stores and pharmacies. The lockdown is expected to last for at least 2 weeks, and it comes as a daily number of virus cases in Israel has surged to over 8,000. So far, over 1.5 million Israelis have received the first doses of the Pfizer vaccine, and more than 50% of Israelis over the age of 60 have been vaccinated. The first shipment of 100,000 Moderna vaccines is expected to land in Israel this week, so that's also some news. Now, we have our correspondent Emily Rose joining us from Tel Aviv with the latest here. So, Emily, you spent the day at this vaccination facility in North Tel Aviv, right behind you. How many got vaccinated today, and what are the age groups that we're talking about here?
So this vaccine station that I'm standing at, it has the capacity to vaccinate about 1,500 per day. Yesterday, they told me they reached about 500, and the numbers were similar today. It's about how many doses they have, and they know they have in store to give out. Now, the people I mostly saw here were in their 60s and over. Those are the people who had an appointment to come here and get vaccinated. But then towards the end of the day, there was a lineup outside, and basically they allowed at first, they had spare doses, so they allowed at first those in their 50s to come in, and then they started giving it out to people who were younger than that, in their 20s even. And really, the medics here told me that it's really up to how many doses they have, because they are working so efficiently that a small station like this, and this is one of hundreds across the country, could get to about 1,500 per day.
Interesting. So basically what you're saying is that they're allowing people, anybody, to really get a dose if you happen to be on site, even if you're not necessarily in one of those risk groups at the end of the day, if there are vaccine doses left over, right?
Well, yes, they did have some left over at the end of the day. Health officials are cautioning and saying that a lot of the people here are perhaps looking for a vaccine, and maybe they are crowding outside these facilities. But for the most part, what we saw today was a very organized line, and they organized it according to age, so that people could really, the ones who were in their 50s, just under the age bracket, could be let in, and then they let in people who were younger.
So tell us about this new lockdown. I mean, what exactly is it going to entail? Because we're in a lockdown right now, so what will be different?
So probably what will mostly be different is the enforcement of it, because up until the last week or so, when we've seen, as you mentioned, we're in a lockdown now, we don't see a lot of enforcement on the street. We don't see people really, even people who are not abiding by the restrictions, we don't see that being enforced. And it looks as though this one will come with heavier penalties and heavier enforcement for those who stray beyond their homes and who go outside the house for non-essential work. A major difference will be schools, likely, because the big debate and the big point of contention over the past 48 hours was whether to close down these schools.
Right.
And we've seen high rates of infection rates in schools particularly. So if we see schools closed down in accordance with this lockdown, that'll be the major difference from the one that we're currently in now.
Now, Emily, what about travel? How is this going to impact travel?
It still remains unclear exactly, though it looks like international travel might not be allowed except for extenuating purposes. But again, if we look at those traveling back and forth and we look at where the higher rates are coming from, it's like three major areas of society: elderly homes, international travel, and schools. So really, it looks like travel could be the one place where that could the virus could be mitigated, the spread of the virus could be mitigated.